I feel like the idea of London being a healthier city, it is possible.
These are clearly ambitious aims. London can meet them.
We are actively moving forward, realising the London-wide agenda of improving the health and well-being of our citizens.
We're working
to make London
make London the healthiest city in the world.
If we all work together, it will be a better world.
Last November, organisations across the NHS and local government and the GLA, together with our national partners and Public Health England, we all signed up to Devolution for London. The principle around devolution is we want to tackle our health and well-being issues locally, within our city.
Rather than having some top-down ideas saying what's best for people, we want people, communities to be in the lead.
Partnership is absolutely integral to devolution.
The Healthy London Partnership is a collaboration across the main public sector partners in London. That includes the Mayor's team and the GLA, the NHS, the councils and Public Health England, and the local GPs and the CCGs.
We have to be able to work collaboratively across the health and social care system with the voluntary sector organisations that we know.
We have a major emphasis on giving every child the best start in life. And in there are nested a number of programmes, from birth right up to the beginning of school age and beyond. And that then yields huge dividends later in life in terms of their health.
As a young person, it's quite hard to be healthy because we have chicken and chip shops and everything. It's like £1 for 3 wings and chips and stuff. Whereas healthy stuff, it's more expensive for us.
We know it's now 1 in 3 children in London leaving school overweight or obese, so something has to be done. Healthy London Partnership looked at the high streets and decided let's take 3 high streets in London, Haringey being one of them.
We ended up working intensely with a chicken shop owner in Haringey.
They came up with ideas of making the popular fast food healthier. Small changes make a big difference. We need to try and make these small changes and get children to buy into it.
We've got the Healthy Schools programme. We've got the Run a Mile a Day programme in a lot of schools. It is achievable. We can make this change.
People who are suffering on low income in the capital, they can't afford a healthier lifestyle.
When you travel down the Central Line from west to east, you almost lose a year of life with every station. The difference of life expectancy between rich and poor is 11 years.
Recently, the Mayor has had agreed by the London Assembly his health inequalities strategy. It's inspirational. People right away want to buy into it.
What I see now is a whole raft of people with the same vision to do the same in London, and that creates massive opportunities to do a whole raft of different things.
If you're someone who's slept rough in London, your average age of dying is still in your 40s, some 40 years less than the general population. Within the Healthy London Partnership, we have a London Homeless Health programme that has explicitly been set up to try and tackle that.
To make London the healthiest city in the world, we have to address HIV. Our programme is the HIV Fast Track Cities Initiative. The aim of the programme is to get to 0. 0 new infections, 0 HIV stigma, 0 preventable deaths from HIV.
The health inequalities approach that the Mayor is adopting around HIV is also really important because what it does is it tries to tackle stigma, prejudices, discrimination and fear that is often associated with HIV.
We've got some really exciting initiatives that are working. The task now is to roll that out to make sure it reaches across everybody.
We want to make London the healthiest capital in the world, and general practice is crucial to that aim. It is the first port of call for most Londoners when they need help. One of the things that we've seen change significantly is the involvement of GPs in supporting much more preventative ways of working.
Social prescribing, for me, it's about identifying non-medical needs which patients have and getting them to that place. Things like financial concerns, bereavement issues, or social issues, and that'll often be sort of packaged as a medical problem. And if you treat the medical problem, then you won't get to the root cause of it.
Social prescribing is about listening to people to improve their health, well-being and feel happier and more connected.
The hospital to home scheme aims to get people out of hospital as quickly as possible to maximise their rehabilitation potential.
I really do think that people are better off being in their own homes, getting better and stronger, rather than in a hospital setting.
I'm very grateful that I can have a nurse at home looking after me, and I can sleep well tonight.
Living Well Warm Forest is one of a number of pilot projects that's designed to target and support people's mental, physical well-being needs as early as possible as people start to struggle. To be able to actively work in a partnership way, joining up services together and bringing people in to this network wherever they come in, and then moving them either into our project where we can do something practical or into other projects that are also in the network is a real privilege, actually. It's a privilege.
Our ambition in London is to ensure that clinicians working with patients have all of the information they need to support people's care. There's an incredible opportunity in London for us to think about how we integrate digital technology into the services that we provide.
Londoners are telling us they want more help to help themselves, and digital technology is a great way of reaching hundreds of thousands. We think they can reach millions.
Using modern technology is really important to improving people's health. Some Londoners will struggle to use digital effectively, but if we can get most Londoners doing it, we have more free time to actually support the other group who struggle.
Digital technology will completely transform the processes of care that currently exist.
What I'm finding with the online consultations and the online software, they're coming back to me and they're really, really happy about the fact that this is such a simple system to use. They can engage with it, and it does for them what they want it to do.
It has completely revolutionized the way we work. You're looking at 2 hours per day clinical time saved. That's 10 hours per week. It makes life easier and access easier for patients, and makes us able to manage our workload in a much better way.
I think the service that's available now does make me feel more in control.
So we're involved in NHS Online Bexley using digital, where we can actually triage patients ultimately from home. Once those patients turn up at the urgent care centre, rather than going through that laborious process, they can be streamed very quickly through checking in automatically on an iPad or within 4 minutes of arrival.
I went to the counter and the lady said to use the new iPads.
When I've been here in the past, I've had to fill out a piece of paper, but this kind of asked me everything I needed. It was a lot quicker.
The Good Thinking project is an attempt to leverage the opportunities of digital technologies to reach people with mental health difficulties, and we want to engage with them to help those who are looking for support find good quality support earlier in that journey.
We all need to understand that at some point in our life, we will face a mental health problem. So we need to take the stigma out of it and find ways that we can improve everybody's mental health.
There's people who are scared. They're too scared, they're too ill to ask for help. They don't have support networks at home and they don't get that help.
And when people's mental and emotional well-being starts to fail, that becomes the points where we often see really significant crises occur because people disengage.
I didn't expect to be sectioned. I didn't expect to lose my mind 5 times. But I did. And I'm here to tell the tale. And it's so important to treat us like human beings. You know, we're not criminals.
We do not lock people with heart attacks up in police cells because there aren't any rooms in a coronary care unit. We do that to people with mental illness, and it's unacceptable. The programme really aims to redesign the way in which people who are mentally unwell, when they're in crisis, are receiving care. Many of the times people were being taken to police cells when they should have been taken to hospitals because there either wasn't an understanding of the right pathway or there wasn't capacity to accept them. We've really been motoring to actually hardwire these plans into the strategic transformation programmes across London.
People are being treated with more dignity and respect in the place of safety than before. I've talked to people who've been through there and they've said how much better it is.
Adolescents and young people in that transitions age range of kind of 16 to 24 years old. We felt like we probably weren't meeting the needs of those young people.
So the Hive is a centre for sort of health and well-being, and it's given me a place where I can just be myself. Having a compassionate person to speak to about something that's troubling you is so liberating and makes you feel so much more free and able to accomplish the things that you want to accomplish. There should be one in every borough.
Thrive is a citywide movement of Londoners all working together in a collaborative way in order to improve the mental health and well-being of all Londoners. How do we help children and young people to thrive? In school, out of school? How can we have a city where some are like really okay and others are not okay? That's what our campaign is really about. Are we okay, London? Are you okay with some thriving and others not? If you're not, come and join us.
So the ambitious goal is, I think, really crucial because it gives you something to aim at.
There's something about having an aspiration that's very clear across all of us, just not to accept deprivation or poor health.
Having an ambitious goal is something that galvanises people. It gives people a greater sense of what they're working towards.
The idea of London being the healthiest city in the world is great. We just have to all push together and work hard for it to happen.
And I think once we can light a spark in an individual about their health and their well-being and about how we connect with each other, then I think that creates a movement for change.
The excitement is palpable at the moment because we really can see something very dramatic happening.
Everybody cares. I think that's why everybody goes into the career that they've gone into in the health and social care world.
We have power when we are united in numbers, and I think it's that leads to thriving communities, thriving societies.
I believe that London can be the healthiest city in the world. What we now need to do is to make that big push in the realisation that the authority and the power to change that is in our hands.